Hello, a warm greetings to one and all. I am Dr. Saravana Karthikeyan, professor from Department of Conservative Dentistry and Endodontics from SRM Dental College, Ramapuram. So I wish to share few tips about introduction to research. So in this discussion, a short discussion, I'll be highlighting what is meant by research and what the characteristics of a good researcher and what are the different types of studies. So I'm just going to brief about these things, so which can be useful for doing a research or starting research or formulating a study design, especially for undergraduates or at the undergraduate level. First and foremost, the word research is derived from the Middle French word recherche, that means to go about seeking or search for knowledge. So, ideally, research is defined as the creation of new knowledge, or, or it can be defined as the utilization or use of existing knowledge in a new and creative way, so as to generate new concepts, methodologies, or novel ideas. So, and to this will enable us to better understand one problem. So I can just give an example of understanding what is meant by research by just quoting this simple example. So, for example, if we are going to buy a car, a new car especially, so what we will do basically, so we'll just search what are the new cars that are available in the market in the Google. We'll be searching in the newspaper. We'll be asking the review comments or some our from our friends or peers or family members or relatives, and then we have to convince our financial home minister or home minister, especially by our mother or our spouse. Okay, and then we'll be studying the car designs, and then we'll be comparing with the other car models from different companies. So let it be Kia or Hyundai or Maruti Suzuki. So like that, we'll be comparing the models, what type of segment we want, whether it is hatchback or a sedan or SUV. So lots of things we'll work upon. So while working or while searching, you will understand the new concepts, you will learn new things about the car, and then finally you will compare everything, and then you will come to a definition or the solution of for your question, which car I should buy. So this perfectly fits the explanation of a research. So if I am going to do on research, I just have to formulate one hypothesis. I just have to look into the literature, look into the background, and arrive at the rational or gap of that particular area, and then formulate one hypothesis, then formulate a study design, and then do the study, collect the data, and then present the results, and then publish it. So this is how it goes. So the research process starts with identifying a problem. So we need to identify the gap, okay, and evaluate the literature. So look into the literature. So do the review of literature properly, and then address the the progresses that had happened in our special field, and then identify that gap, and then formulate one study hypothesis. So when we talk about the hypothesis, there are two types of hypothesis: null hypothesis or alternative hypothesis. For example, if I am going to compare a drug A with drug B for its efficacy, so my null hypothesis will be there is no significant difference between the drug A and drug B in their efficacy. Is the null hypothesis. So alternative hypothesis is that a drug A may be better than drug B in its efficacy. So these two things, we should know. And when we are writing for an article, definitely we have to mention either null hypothesis or alternative hypothesis or both. So this is how a reviewer what a reviewer will expect in your paper. So while doing the study itself, while designing the study itself, before designing it, you have to create one strong hypothesis or rationale that forms a sound rationale for your study, and then do the study design. So if it is in vitro or in vivo or ex vivo, so I'll explain what are these kinds of studies in the next slide. So you need to formulate one study design that aligns well within current literature, current accepted methodology, and current standard comparator. A control should be there. So, for example, if I'm going to study about the restorative material, we'll take our own specialty biomaterial as one example, glass enamel cement. So, I am going to formulate one new material alternative to GAC, glass enamel cement. So, for that, I need to thoroughly study the advantages or pros and cons of GAC, and then identify the gap. So in what ways it is not performing better? So how I can improve the properties? So for example, if it is not radio opaque, glass enamel cement is not so radio opaque. So I have to add some radio opacifiers like strontium or barium salts or other metal oxides, so that it will be radio opaque. They can see the difference between the secondary carriers as well as the restorative material in properly in the X-ray. So for that, I have to compare with the standard control, that is GAC, and then buy a new material. So I have to formulate a study design in such a way that okay, I have to analyze all the properties of the new material in comparison with the standard GAC. So the study design should be proper with appropriate methodology that aligns with today's evidence-based literature. Okay, then describe the population if we are going to do an clinical trial or in vivo study. So what type of population I am going to involve? For example, if I'm going to analyze one new material, like a new pulp capping agent, an alternative to mineral trioxide aggregate, so then I have to describe what kind of population, whether I am going to take only reversible pulpitis or either symptomatic irreversible pulpitis, or going to do direct pulp capping or indirect pulp capping. So those things. So we have to adequately describe what type of population I'm going to do, and what about I'm going to assess only the Chennai-based population or Tamil Nadu-based population or Indian representative Indian population. So I had to be very specific. And then once I'm study design is done, so I have to start the study, do the study, and then I have to collect the data appropriately, through proper data collection methods, and then the data analysis should be done by a proper statistician through proper statistical tools, and then finally I have to collate the results, compile the report, and then submit the thesis or dissertation or my project, and then the outcome of that one will be in the form of publication or patent. So this is how the whole research process works upon. So the word researcher consists of various letters, okay, and each letter stands for one acronym. For example, researcher, when we say R stands for the researcher should be research oriented, should be efficient. Yes, for scientific, should be effective. The researcher should be active, resourceful, should be creative, honest, and economical in conducting a study, and should be religious. So the researcher should always have intellectual curiosity. So we should question ourselves what, when, why, who, where. So ultimately, the study design or the outcome of the study, whether it may be success or failure, it lies in the hands of the researcher. So always, we need to be prudent, honest, and ethical. And when it comes to types of research studies, we can simply describe the research studies in the form of a pyramid as shown in this slide. So the base of the pyramid, carries a low strength of evidence. As we go towards the top of the pyramid, the strength of evidence increases and it will be, highly clinically relevant. So we start with a non-human studies in the form of in vitro studies or animal studies. So that carries a low strength of evidence. Then comes our observational studies. When we talk about observational studies, so it will be a cohort study, so assessing the incidence or prevalence, like case control and cross-section studies, or it can be a question-based study. So it just a descriptive study. So just an observational studies that in a particular population. So this is kind of studies which we commonly employ at an undergraduate level. So we can just, an example what I can give is, so just to assess the, uh, uh, success of the endodontic treatment, so done by general clinicians or dental dentists in Chennai-based population. So we can just an observational study, like question-based study, we can just formulate, or we can just get the opinion from the KP study, knowledge, attitude, and perception by the patients towards endodontics. So we can just do one question-based observation study. So this is an example for that. And then comes your intervention studies. So when we talk about the intervention studies, it's a clinical trial. It can be a randomized control trial, or it can be a prospective cohort study. So when we do, studies in patients, it becomes intervention studies. So where your experimental group should be compared with the standard commercially and clinically employed on material. So in a clinical scenario. So then you comes the highest level of evidence, that is through meta-analysis and systematic reviews. So this is study pyramid research studies. So most of the times we end up doing only in vitro studies. So that is the all the experimentation part will be done the tabletop, now outside the living organism or outside the human body. So simple example, what I have said earlier itself, I am going to compare one X material with GAC cement. So then I'll be just comparing the physicochemical properties. So for example, setting time, color of the new material, and then compressive strength of the material using universal testing machine, or the micro harness assessment using Vickers harness indenter, and then setting time, as I mentioned, using Vicars needle or Gilmore needle apparatus, and then pH. So and then fluoride release using a fluoride probe. So this is how I'll be doing this in vitro study. So when I'm going to test on X material, I'll be comparing with the standard GAC. Okay, glass anamorphic cement. So now we should always have a strong standard comparator. So totally all the studies will be done in the tabletop outside the living organism. That's what in vitro studies mean. So next comes the ex vivo study. So the typical example, what I can give is, we can again take the same comparison, that is X filling material or restorative material alternative GAC. So GAC is a comparator, and my X material is a normal material, is a experimental material. So what I want to check is that I am going to assess the study, means restoration to interface leakage. Okay, so I just have, I'm planning to do one XYO study. So XYO meaning part of the study will be done inside the human body or animal or living organism, and part of the experimentation and analysis will be done outside the body. So the same example as I mentioned. So comparing, GAC with my X material, experimental material, I can just prepare some cavities, calcific cavities. Cervically in the premolars that are we are planning to go for extraction for orthodontic reasons. So I can just prepare cavities and place it, and then I just observe it for period of 1 month or 3 months, and then I'll be removing it. and then I'll be checking the parameters outside the human body through like SIM. I'll be analyzing. I can analyze the interface between the tooth and the restoration in Group A, that is standard comparator of GAC, and Group B, my experimental material. So part of the study is done inside the body, part of the study is done outside the body. That becomes ex vivo. Then comes the in vivo. So where the experimentation will be done inside the body. So again, analyzing the pulp efficacy of a pulp capping material. So that will become a randomized control trial. So it becomes a part of in vivo study. So this is what various studies mean. So for a beginner, so understanding the research will be little difficult, especially for an undergraduate. So I hope in this short presentation I have highlighted so, what is meant by research, and what are the characteristics of a good researcher, and how to kickstart our research, and what are the types of research studies. So, hope this video will be useful to you. So, thank you so much for your patient listening. If anything, you can get back to me personally through my email at saravanb@srmst.edu.in. Thank you.